Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. The topic for this program is Reengaging Healthcare, a very timely one. And with me today, I have two guests. I have Dr. James Trumble, the Vice President of Clinical Integration at Peninsula Regional Medical Center, and Dr. Karin DiBari, also working at Peninsula Regional Medical Center. She is the Chief Physician Executive, though, of the Peninsula Regional Medical Group. So two high-ranking physicians from Peninsula Regional, and I welcome you both. Thank you so much for coming on.
Thank you for having me, Mary.
Glad to be here, Mary.
So I think, Jim, you're going to get us started off just by talking about where we are with the COVID pandemic and the hospital's response, and then how we're going to move forward with all this in terms of re-engaging healthcare.
So we're a little over 2 months into the COVID pandemic, and there's been certainly several actions that the hospital has taken to prepare as this happened and to step up to the need that exists for us here on the Eastern Shore. I mean, without a doubt, Peninsula Regional is the tertiary referral center for the area, and it's our responsibility to be ready to accept these patients. So we did several things in the process. We made preparations in our ED emergency department, separating areas there to prepare for patients coming in. We expanded our ICU, in fact, turning some of our conference rooms down in the basement into ICU beds, including all sorts of infrastructure, as well as expanding the number of ventilators that we had available to accommodate the large number of patients that we expected. In fact, one of our towers here, we changed the entire airflow just to be able to accept patients in large numbers as we expected for COVID. Ironically, I think that also poises us to be able to come back to what was normal beforehand in order to be ready to accept patients for elective procedures, bringing them in for testing and treatment. Certainly, there's been some conversation about, even before the COVID pandemic existed, that, we want the right care at the right place. So, for those things that we could delay, such as elective procedures, we wanted to have those patients, not necessarily come to the hospital, because initially, certainly we had concerns about how infectious this disease was, and we didn't want it to spread it to patients who came in without it, and we didn't want them to contract it, despite the fact that we took all of these measures to prevent that from happening. But, we're at a point now where we really need to re-engage those patients. We are seeing patients not coming in who desperately need that long-term treatment for chronic care or sometimes for acute care. So it's certainly vitally important to re-engage those patients for their diabetes care, heart failure, COPD, not to mention those things that we've asked them to delay for elective procedures such as knee replacements, colonoscopies, the list goes on.
So, Jim, I think we've done a lot of wonderful things in the hospital to prepare, but you've really started having some conversations with public health and other hospitals, because we've seen that although the governor put an order in place for us to hold off on having patients come to the hospital that we could hold off on. You talked about, those people who might have a chronic condition or those people who have elective surgeries. I think our concern at the time was that would we have enough capacity to take care of everyone who's sick? And what we've seen is that we really do. That expansion of the ICU helped us increase our capacity. We've been able to secure our supplies. People talk about, I think everybody today knows the word PPE, right? We talk about personal protective equipment, and that protects our healthcare workers, but it also protects our patients. So we've secured all those things, but what we've seen in an effort to keep people who could stay home, what people have gotten so fearful is those that have care issues that can't be delayed, like signs of a heart attack, that some of those people have been staying home for too long and are coming to the hospital at a later date and are harder to care for. So do you want to talk about the public health campaign that you're working on?
So we've reached out in several venues. Where right now we're in the process of doing various types of newspaper, billboards. There's also podcasts and various other media modalities that we're using to try to reach out. In addition, even through just the testing that we've done, we reached out to several of the communities here in Salisbury, and this kind of relates back to the actual testing that we did for coronavirus. But as we go forward, what we're really focusing on now and what we're doing in collaboration with other hospitals in the area, including our own sister hospital, Nanticoke, but other hospitals in the area, including Atlantic General as well, to bring about and get those patients back in to emphasize how essential their care is. There's certainly stories that we've had about patients with chest pain for extended periods of time coming in only to find out that they're having a heart attack, patients with delayed symptoms of stroke, those who have come in to find out that they've been walking on a fracture for over a month, even surgical problems such as appendicitis, delays in that, which can lead to problems down the road for them as well. So it's important for patients, if they're concerned that they've got an emergency problem, they really need to come in. Now that said, there's certainly other issues, as Karin mentioned, such as those with chronic disease, such as heart failure, diabetes, have prevention as well, to have those interactions with your primary care doctor. And this is true for our own medical group and true for the community doctors as well. They are all open for business. We are there and ready to see patients across the board. And not just the primary care doctors, but specialty doctors as well, our cardiologists, our surgeons, they are available. And we're putting things in place here at the hospital to make this a safe environment for everyone. We have set up not only screening and testing for our own employees, but we're doing that for those patients coming in for procedures as well. So I think that's an important part. There is an intensive cleaning process going on, just like you see actually with many of the businesses that are opening up. Every time that we have a patient that comes through there in a bed, I mean, this was common practice that we had even before the coronavirus, the COVID pandemic. I mean, you clean the bed, you clean the chair every time a patient's been in it. We're doing that, tenfold at this point. So we want to emphasize the fact that the hospital, in many respects, may be one of the safest places around right now, because as you go out and around, you don't necessarily know who has it in the community. You could pass by someone. Hopefully, everybody's wearing a mask and social distancing as well. But here in the hospital, we are taking so many precautions to keep that from happening and to keep everyone safe.
And we're doing the same thing in the office environment as well. We're screening our office staff before they come to work. We're screening patients. If you're a patient, I'm sure you've gotten that phone call, are you feeling well enough to come into the office? For those, a lot of people don't realize how much work we are still doing at the hospital and we're still doing at the offices, and we're doing it safely. We're still seeing a third of our visits in person in the office setting because they need to be seen and screened. But as we talk about reopening, that's what this show is all about today. It really is about saying, okay, we've been in this now for 10 weeks. What do we need to start doing? And that care that can't be delayed forever. Before COVID, we had campaigns. Please have colon cancer screening done. Please have breast cancer screening done. And so your physicians, the primary care doctors, are starting to have conversations now about saying we need to start thinking about engaging patients in those type of screening events so we don't have more breast cancer, we don't have more colon cancer. So the office and all of these different facilities are working to separate sick patients from well patients, do those same things that the hospital is doing, the extensive cleaning. And we're going to continue doing telehealth in the offices. So if it's care that you can do via a video visit, we'll do that. That will allow us the social distancing concept. We'll have less patients in the office because some of them will be on video, some of them will be in the office. But I think it's really time to start thinking about, first those people who have chronic conditions to check in on them, but then to start saying, if you've really put off your colonoscopy for a long time, because how many people put off their colonoscopy for 2 years and we're just about ready to go and now have put it off? We don't really want people to put it off for too long. So, the offices are going to be reaching out to patients, and we want them to realize that we're safe and that we're doing everything to keep them safe, and their health care is still really important.
So I think the important parts here is a couple different things. That we are, without a doubt, open for business. We have been, and we still will be going into the future for all those things that our patients need for this area. Our offices are open for business as well, and they have been. And there's different ways to approach this. There is in person, there is, as Karin mentioned, the video telehealth options. And so for those patients who have difficulty getting out, those opportunities are even more prominent now than they were before. But I think it's important for everyone to realize that this is a safe environment. We are taking extraordinary efforts to make this safe for everyone involved. And that goes not just for the infections, but the things that we've always taken seriously. And that is preventing, complications, preventing infections here in the hospital, and making this an environment that everybody, wants to seek out so that they have the best care that they can.
And I would say the final thing, one of the messages I've always had during this whole pandemic is don't be afraid to call your primary care office, right? We can help you understand where to go. And I think that, there's been a lot of campaigns before COVID about getting care in the right place. And if you're worried about where that right place is and how you should engage in the healthcare, your doctor's offices are willing to talk to you, and they will suggest what is safest for you. We know, right, you're working with doctors in the community, I'm working with the doctors in the community to make sure that they know how to keep their patients safe, to know and to think about what visits are done where, at what time, so that we're keeping everyone safe.
It sounds like both of you made some excellent points, of course, about giving our viewers some peace of mind, that they can call, or they should not hesitate to seek medical care, in some way at one of your locations, whether it's the hospital, the emergency room, or the medical offices and so forth, because that's so important to have peace of mind that their needs will be tended to. So maybe, Jim, if you could just give us a few key take-home points to summarize the program about the importance of re-engaging the community in healthcare again.
Absolutely. So as Karin just mentioned, I think one of the most important things is get in touch with your primary care doctor. If you don't have one, please get one. We do have plenty of providers in the area, many of them looking for patients. So it may require a couple of phone calls, but they are out there and ready to see you. Don't hesitate if you're worried that you have an emergency condition. Use the emergency department. That is what it's there for. Our hospital is ready and waiting to take care of patients. We're certainly, opening up the opportunities now for elective procedures that we had put on hold, and we appreciate those patients putting those procedures on hold and delaying the care. But you can't delay it forever. You can't forego one disease process or avoid it in lieu of another. These things need to be addressed, so it's important to get seen either at your primary care doctor's office, the emergency department if it's appropriate, an urgent care, a specialist if it's appropriate. And we are making huge efforts to make sure this is safe for everyone. So please see your doctor.
And if I may, I can ask everyone to please be safe yourself. Keep us all safe, right? As much as you may be very, very tired of wearing your mask, wear your mask when you're out in public and wash your hands. That will help keep us all safe.
Yes, and the physical distancing is also important. I think everyone's familiar with all these guidelines, but it's getting old. This has been going on for a while, but as I've heard many people in the healthcare field say, COVID is here. It's here for a while. Yeah. So we're just going to have to be smart.
So lastly, just want to thank all of our patients and thank you to the healthcare workers. This is really very much frontline work. And I know there's been a lot in the news about it, but it is very difficult work, and they have gone through a lot to take care of our community. So we really should applaud all of their efforts and all of the work that they've done. So thank you, everybody here at Peninsula and across the nation and across the Eastern Shore for all of the work that they've done.
Absolutely, well said. I know we have a lot of our nursing graduates working at Peninsula Regional, and I know they're all out there in the trenches doing their part, as is everyone involved in the healthcare process. And I want to thank you both for coming on the program. I know you're both quite busy, and I really appreciate you taking the time to get this word out about how important it is to get people back, into the healthcare system, to utilize it appropriately. So thank you again.
Thanks for having me, Mary.
Thank you for having me, Mary.
And thank you for joining us for this edition of Focus on Health here on PAC 14.